Hello, everyone. Can you hear me well?
Yes.
Very good. Actually, I was thinking at the beginning how to carry on the webinar. We have two options. One is a webinar. So I'm talking, whatever you talk, I'm not able to hear. And there is another option, it's a conference. And I have chosen the conference for one very important reason. Because when we are at the conference, we are together. When it is a webinar, it's just me talking in front of the wall. You're not able to respond only by typing. We're not able to communicate. And I think it is very important to communicate because we are doing something together. One thing that bothered me is the noise. So choosing this option, I thought that we will appreciate our silence during my talk. And then we will be able to discuss, to ask questions. I think it's more fun than only typing. What do you think? So you are able to open and, mute and unmute your microphone and video. And at the moment, I suggest we just switch the video on to say hi to each other. Before doing that, I'd like to mention that we have quite a lot of subscribers and participants, but because it's Saturday, July, not everyone was able to join, and they will listen and see the recording of our webinar. So whoever wants just to say hi to each other, we'll see. Hi, hello, glad to see you all. Hi. Hello, hello. It's nice, we are together. And each of us, everyone has its own reason to join the webinar on advanced balance method. Someone I know already attended the advanced method webinar of Dr. Tan and would like to revise. some people just first time would like to develop new skills, and some other people have their reasons, but the main reason is the progress. The worst is stagnation, to be stagnated in one certain place, in one method. I just learned this and I practice it for 40 years. This is good. Someone chooses this kind of style, but to me, the natural style of any practitioner is just to move forward. So the advanced method, to me, it opens the door. So I will try to explain it in a very simple, a way so everyone could digest. Because I remember how difficult it was, with all my respect to Dr. Tan, how difficult it was to grab the main points. So I attended quite a few times, and I practiced a lot, and until I just started to understand what's going on, just to feel myself free in this kind of complicated logic and way of seeing the acupuncture. So, among us, could you please say yes, who already practices the advanced balance method or attended the seminar or webinar?
Yes.
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 Yes, I did as well.
Yeah, 4 of us, but we don't know about those who is not with us. And could you please explain, some who wants to say, what is the reason for you to attend the webinar?
For me, it's just repeating.
Revise.
Because I did with Delphine and I think 3 courses, but you know, it's a big crowd, it's very fast, and after 4 days your head is really full, and then you come home and then you have to practice, but it was too much information in a short time and so many people. So, and I really like your courses because it's very it's how to call it, it's very quiet, it's very, you know, very not so fast, so I can understand.
Yeah. It's only me. Yes.
but I'm practicing already, and I have great results with what I know. But so I'm repeating and repeating again. So with the meridian conversion, I'm not so already, and also the seasonal balance, it's not in my system so very good. So I want to repeat it again.
Thank you. Anyone else? I understand. So it's a revising. Well, it's better because it's nice that we can go through the material a few times. Mm-hmm. But anyway, organizational structure. I think we will have a tea break at around 3 o'clock London time. And 5-10 minutes break, tea break in between, like 45 minutes. Yeah. Is this okay? Yeah. Good. To breathe for me. Well, anyway, so today we're planning 2 things, meridian conversion and 12 magic points. I thought, okay, let's start with 12 magic points because it's quite different from all the Bhagwat style acupuncture. But then I thought, no, we'll do meridian conversion first. People think that it's boring just to convert the meridians. But behind this, we will gain few things. First, we will deeply revise the global balance patterns, which I think everyone needs. So I think the complicated things, they don't exist. The things must be simple. Then we will remember them, and then we can develop from this simplicity our own way of doing things. Because the complicated knowledge, to my experience, it doesn't stay. It's just we just go away from that. We develop our own way of doing this, kind of similar, but our own way. And this is the most precious thing we can do. But we base on someone's shoulders. So the basic thing, I think, let's do some simple revision of what we know in a very simple way. What do you think? Okay, so let's see if my pen works. Yeah, the marker. Okay, so you know this table, and those who bought the book, which I recommend, the Global Balance Method with Pulse Diagnostics, you could see this table at the end of the book. But there are two mistakes, my fault, in the book. So I corrected them here, so you have an advantage. So these two patterns, they are written in the wrong way. So you just correct it. So, but we will go through. Every book has a lot of mistakes. Not intentionally, but well. So my book has them as well. So when I read it the second time, the third time, the 12th time, I saw them, but it was already too late. But never mind, I will correct them later. But it's nice because it keeps the attention of the reader, motivating not to digest blindly everything that's given, but to think that, this is not right. And this is very good. I think every book must have something like this. So it keeps our attention, okay? Before going through the patterns, I would suggest one thing. Look, we will have a break in 1 hour. Well, what time is it? So UK time is 12. So 1:30 UK time. My time is Spanish time, is 1 o'clock. So 12:30 UK time. And all the questions I will be able to answer 10 or 15 minutes before the break. Let's keep them. You will write them down. Otherwise, we will dive in the answering questions into the discussion. Okay? So let's go through revision. Because we will work with these patterns today until 3 o'clock UK time. Let's see the Yang Ming patterns. When the patient comes, it's a huge unknown universe. Every new patient. In my school, I went to school of Jimmy Chang, which I highly recommend to tackle, because he's just a good master. And everyone can take something from a good master, something we can use for yourself. And Jimmy's rule is, do not ask the patient anything. Say hi, please sit down, because they want to know what's going on with their body. They don't know what's going on. Don't ask them, they don't know. Their ego will speak instead of them. But you have to treat the core, not the ego. So First of all, you take the pulse. You don't know anything about this patient. And then you come up with precise picture of what's going on. I would suggest to listen a free lecture of introductory pulse diagnosis on my website, just how to take this pulse. Believe me, this is a precise method. You can find mitral valve regurgitations and aortic valve regurgitations, murmurs, and you can distinguish them. You can find so many things. I remember one patient came, we had a seminar, and the guy came and said, you know why I came? And he's a doctor, he's a director of a big clinic. In Russia, I teach doctors. I said, why? Because you said that I have varicocele on the left testicle, on my left testicle, when I came to the last seminar. And then I went to the scan and they said to me that I had varicocele on my left testicle. So it's so precise, don't miss it. Because Jimmy Chang is quite old, he's still alive, he's functioning. His lectures you can find on YouTube for free, and some of them are, they might be expensive, but I think the Ilotus, they have a good presentation of everything. You can teach, or you can learn it easily and work it out with each and every patient you have, every pulse. So coming back to Yang Ming pattern, if you listen my introduction, free introduction on pulses on the website and learn the book, the easiest way to see whether it is a Yang Ming pattern is the pulse. Is the right guan, and you keep the hand of the patient on his side, otherwise the pulse system doesn't work. If the right guan is weak, how to understand it's weak? You press, it disappears, or it's a bit muddy, or it's too tight, or it's too wiry, or whatever it is the Yang Ming problem. And the stomach is the basis of everything. We just remember, okay, stomach. Another step is the ear. After I take the pulses, I say, could you please allow me to take your ear pictures of the ear cell. So I take 2 pictures with a good light, and then I zoom them on my phone. So you can see exactly what's going on with the body. You can see all the stomach problems, if they are. You can see the neck, you can see many things, but the main thing, you can see the colors. You can distinguish the stagnation in gallbladder from inflammation in gallbladder. You can see the cold stomach and the hot stomach. So you can see so many things. So you write it down. All this together takes about 3-4 minutes. And you have a picture of the patient. I was thinking of schedule a webinar of about the ear diagnosis only. Well, you can find in my Global Balance lecture some of the hints about the ear. But we can do it, but by request, possibly. So if I have enough participants, we can do it. So But if you're not skilled in pulse and ear, you have your own preferences and TCM diagnostic choices, and of course, patient's complaint. So anything with digestion is the top line, is Yang Ming. The number one, Tai Yin Yang Ming, is the basic pattern for everything in front. You can't do wrong with it. If any digestion problem, you start with Tai Yin Yang Ming. When we do the conversion, we will see why. Children up to 10 years old, they don't really need other patterns but Tai Yin Yang Ming. This is a basic pattern of survival. Anything with digestion, anything with cold, Tai Yin Yang Ming. I had one situation. I was flying with my friend and she had a cold. And I know that for cold, meridian conversion Tai Yin Yang Ming works absolutely great. Without thinking, you just do conversion for the cold pattern. If everything, if the whole body is suffering, you do Tai Yin Yang Ming. And I did Tai Yin Yang Ming, and there was really no difference, just a little bit. Yeah, she felt slightly better, but we used to have good results. So I realized that something is not right. And then I took the pulse. That was my mistake. And I saw that the liver was jumping. So next day, I did Yin Yang Ming to her, meridian conversion, because it's a whole body thickness. 80% of improvement straight away. So the pulse matters. How to recognize the liver? The tongue. The tongue, yes, you will see the side of the tongue a bit red, but it's not as precise as the pulse. So the general pattern Tai Yin Yang Ming under A, the Yin Yang Ming when we have the liver presence, any kind of allergies, any kind of stress, we're all stressed. What is stress? Is when people live in the past, in their history. 99.9 if you are not enlightened master, we all live in the past. And liver works without toxins, mental toxins mainly. So this is Tai Yin, Yin Yang Ming. And then we come to 4 magic meridians of Dr. Tan. Pericardium, kidney, Yang Ming. This is a beautiful combination. And very often we combine them together. The B1 and B2. Just adding kidney or adding liver at the same side. Okay? What is this for? If we call Tai Yin Yang Ming the wide, where is my assistant? The wide front, anything that happens on the front, it's Tai Yin Yang Ming. But kidney situated as a narrow line in front. So we call it narrow front. So everything that concentrated more close to the red meridian is pericardium, kidney, yang ming. What is this for? Any gynecological disorders, the heart, the thyroid, anything along this line is pericardium, kidney, yang ming. Beautiful for gynecological stuff and beautiful for heart diseases. I have so many patients, so many complicated cases, very complicated, treated with one simple treatment. You know, the heart treatment, yes? With kidney 1, large intestine 3, stomach 40.5, and yeah, what else? Pericardium 6. Beautifully. And we can confirm it with a pulse. What I suggest, guys, just those who are not familiar with the pulses, just try one. Just try one pulse. On the left hand, when the patient comes and you take your pulses, I don't know how you take them, like this, but I'm not saying this is wrong, but I just don't know how to work with this system. But try one. When the hand is on the side, put the hand on the side. There is a tendon, I don't remember which one. It's on the top, something longus, on the top. This is my thumb, it's on the top. Put your finger when the tendon is relaxed on the top, on the tendon, and try to see the pulse there. If there is no pulse on the tendon, that's fine. If there is a pulse, we call it mitral valve pulse. So this is the mitral valve. This is regurgitation, heart regurgitation in the mitral valve. Just try one thing with each and every patient, and you will see this pulse sometimes. And then you will understand that the problem is in the heart, because the blood is not circulating, it's heart. The breathing is difficult. It's not lungs, it's a heart, because there is a mitral valve pulse. The aortic valve can be seen in a different place. It's here. It's very easy to find. You think it's complicated? No, it's easy. So just try this, and then when you enjoy it, you possibly join the pulse diagnostic crew. Well, anyway, so we went through 3 patterns, and the number 4, look, there is a Sanjiao. We still consider it under Yang Ming patterns because it's earth here, stomach and spleen. There is a Sanjiao. Sanjiao moves what? Water. So any problems with water retention, but not heart water retention, when the ankles are swollen, it's a heart problem. But you still can possibly use it, but mainly when it is a stomach problem, when there is a dampness, not the heat, but mainly dampness. So you can see, you can use this. I do remember the lady came to see me with a tooth problem. The tooth was inflamed. So I treated her with this pattern. the poles show very big dampness and damp heat in the upper jaw. So there was like 70% improvement after the first treatment. She was absolutely shocked. But you know how balance method works brilliantly. That's why we're here doing the advanced course. So if there is a sign of dampness caused by the earth, because stomach and spleen is the earth, you're very welcome to use this. Works like a magic. There is another digestive pattern here, which is Zhu Yin Shao Yang. It sounds strange, but pericardium will treat the stomach. Pericardium here will treat the stomach. It's kind of digestive pattern. So we can use it for digestive problems as well, but mainly is a pattern of ego. It's a quintessence of ego. If Zhu Yin Yang Ming is the basic fear, the pulses will be wiry. The people are not uncertain. It's more for, of course, there are a lot of ego in each and every one of us, but it's more about uncertainty and fear. But this is the anger. This is Xiao Yang. Okay? The liver here must be very pronounced on the pulse. The sides of the tongue definitely should be pronounced. Possibly the problems are on the side, so everything on the side, headaches, sciatica, pains between ribs, everything related to gallbladder. The area of gallbladder must be also on the ear, can be also seen. But we should not blame the people having this pattern because they're angry. No, it could be just a stress. The level of stress in our world is quite high. So to pacify the liver is this pattern. But be very, very do it very accurately. Recently, I had a friend who came to see me, and it was very hot in London. Not recently, I think it was quite a while ago. It was very hot in London, and I took the pulses. The pulses were jumping, and I know this person. He was very, like, he knows how people must behave, and well, this kind of gentleman. And he didn't feel well, so I took the pulses were jumping, and kind of it was very quick. I did Zhu Yin Xiao Yang. He couldn't walk during a whole day. He was so tired. I made a mistake. He was not Zhu Yin Xiao Yang person. I just knocked him down completely. Mm-hmm. He required Zhu Yin Yang Ming pattern, because this pattern, Zhu Yin Yang Ming, brings people up. It tonifies. In general, I'm saying the general, relaxes but tonifies. But the Zhu Yin Shao Yang, it pacifies people. It can bring the energy down if needed, if it's too much on a hill. But we must be very careful in choosing this. You remember, possibly in conversation, we also ask about sleep, how you sleep. These people, they usually, when they don't sleep, they don't sleep the whole night, half of the night. They can stay without sleep until 1 o'clock, 12 o'clock, and then they sleep. The Yin Yang Ming people, they wake up, they go to sleep. They wake up, they go to sleep because they worry. They're warrior. Those people, they are not warrior. They already know who is wrong. They're stressed. And then we come to another type, which is Xiao Yin, Xiao Yang. This is the end of the story. If Zhu Yin Yang Ming is the beginning, the warriors, then Zhu Yin, Xiao Yang, the angry people, and then we come to Xiao Yin, Xiao Yang. These people are so tired to be angry, they become depressed. And this pattern works amazingly if you do it right. For people who work a lot, they are tired and tight. They need support. The kidney and heart are exhausted. The Xiao Yang is stagnated because they are under stress, under control, and they work too much. The good people, sometimes they sleep, and when they wake up, they feel tired. This is important for them. So 1, 2, 3. It's very easy to distinguish, but here there is no digestion. In Xiao Yin, Xiao Yang, there is no digestion problems. Okay. And now we come to the hormonal treatment. Anything about hormonal changes, you can try. I don't use this pattern very often. I use it as a part of gynecological treatment mainly, but sometimes patients don't need many needles. They want to try something simple. And this is the reward for everyone. The fever, the heat pattern. How often do you use it? I use it very often. This is the greatest pattern I've ever seen for any temperature, for any heat. They just do the meridian conversion without thinking, and they need a blanket. For any heat, that can be empty heat, this can be fever, that can be, well, whatever. Doesn't matter what. It can be the, how it's called, living in Spain, I forget English. When the temperature comes only for a certain period of time during the day. In Russian, we call it subfebrile temperature, just for a certain period of time, like from
Tidal fever.
Pardon?
Flare-ups. Like
Yeah.
Like
Tidal.
Yeah. So this is great as well, but the patient must come just an hour before. Or it really doesn't matter. Well, all clear about this. And then Tai Yang, a beautiful line and very simple, because it's all about the back. It's all also about fertility. You can see Tai Yang, a problem on the back. If the heart is involved. Xiaoying, Taiyang. If any problems with breathing, middle chest, spine problems, Taiying, Taiyang, coughing works beautifully. If there is a problem on the back, but people are tight, there is a lever which compensates the stress, works really well.
Mhm.
And the last pattern, which kind of difficult to call because it's a combination of lung, large intestine, blood, and kidney, metal over water, let's say. I used it a lot for infertility, for men infertility, for those with deficiency, with low sperm count. Yeah. So they kind of overlap. But the main thing I'd like you to remember is first line, digestion. The second line is gallbladder, everything on the side. And the third line, Taiyang, is the back, fertility, and anything related. We have two more patterns. Is a digestive pattern, which works for any digestive problems, and for hangover works absolutely brilliantly. For any digestive, I checked it, it works. The only thing that one story I'd like to share with you. I was teaching in Russia, and it was one lady who had a stomach pain. I was teaching the local balance. They're all doctors in Russia. If you practice, possibly like in Germany, you have to be a doctor to do acupuncture. So she said I had some pain around the stomach. So I did the local treatment, didn't help. I did the 8+1 digestive pattern, didn't work. And I said, you must go and do the investigation. And she did it, and it was a cancer. So this story illustrates that, yes, it does help, but it wouldn't help for these deep problems, okay? So, this is about 8+1, and another treatment is gynecological treatment. So I think we covered all 12. Now there is a short brief for questions. If anyone has questions about the patterns now, in a brief way, something is not clear or something you would like to ask about the patterns. This is good. This is good. So we did a bit of revision of everything, which is very, very important. It will serve for today, for meridian conversion, and also for next Saturday, because we base our 5 elements therapy and seasonal acupuncture on patterns as well.
I have a question, please.
Yes.
I am a bit confused about when you say the names of the organs, like gallbladder, what it literally means. If it's like, you know, Zangfu gallbladder, or if it's like gallbladder channel, or if it's a gallbladder system, because in gallbladder system, if you talk about the whole, let's say, Shaoyang, right? I'm not clear what it consists of, because, you know, or, you know what I mean?
That's a good question.
I don't know, because in Chinese medicine, it's so confusing, all these terms, and it can mean so many things. I don't know how broad the gallbladder term is, if it's just the organ, or you know what I mean.
Absolutely. That's a good question. Let me answer, please.
Mhm.
When we talk about local balance, we speak about channels only. Okay, which meridian goes through the channel, right? So it's clear. When we are in global balance, we speak about systemic disorders.
Yeah.
Nevertheless, we define the meridians that go through the organs. Okay, you may remember when we discussed the heart treatment. Yes, it's very confusing. I have a problem in the heart. No, I have a problem in stomach meridian that goes through the heart. Yes, so it's very illustrative. So it's not the heart. There's a problem in the stomach meridian. It's a muscle problem. If this is a heart problem, that's completely different situation. How to see heart problem? Well, it's just medical stuff, scans or pulse. Actually, we see the problem on the pulse even before it comes to the scans, before it's seen on the scans. Okay. And when I say heart here, it's kind of mixed.
So all together.
When I say there is a heart problem, we must understand that I'm talking about the heart problem. When we say Zhu Yin Yang Ming, for example, we speak about the meridians only. It doesn't relate to the liver. However, the liver, the condition of the liver is connected to the meridian of the liver. Indirectly. And we can see the condition of the liver in the pulse, and we needle the liver as a meridian on a pattern. We know that the organ and meridian is different thing.
Yeah.
Yeah, but they are connected through the internal pathways, meridian pathways.
So when you say liver, you also mean eyes, tendons, and ligaments, or only liver as the organ?
Let's put it in this way. When we come to the herbal medicine, we consider that Zhu Yin Yang Ming is not a liver problem. Is a fear problem, is a stress, and liver is tackled because it's a bit tight. This is a liver problem. Zhu Yin Shao Yang. Is this clear?
So when a patient comes with eye problem, it would be Xiaoyang. This one, the last one you showed us.
Necessarily, because the eye problem, which meridian goes through the eye, it may not be a liver problem.
Okay. So when you talk about liver, it doesn't consist of all other tissues that are usually related to liver in 5 elements, let's say.
Say it again, please.
So when you talk about liver, you don't mean all those other tissues that are related to liver, let's say in 5 elements theory.
Maybe yes, maybe no. But when we speak about the eye problem, it's a local stuff. The liver may be involved and maybe not.
Okay.
We speak about the channel which goes through the eye. Yeah, it can be gallbladder, and the liver will treat gallbladder as a channel. Okay, as a couple. System number 3. All right.
Okay.
So we're finished with the patterns. Everyone is happy. And now let's go to our subject, the meridian conversion. Why we need to learn meridian conversion? What's the fun because we know the numbers. We know that long 3 and 11, or sorry, large intestine 3, 11, lung 9 and 5. So they will just make a picture for, make a combination for meridian conversion pattern. We all know it's in the book, it's everywhere, it's in internet. Why do we need to learn it? Because I think that without deep understanding of why it's happening like this, we won't be able to feel the therapy. We are not satisfied with the superficial knowledge, at least without complications. We want to know why it is like this. And today I will try to explain it in a way you will grab the main point of it, okay? So, first of all, why do we use meridian conversion and when? Imagine someone came to see you with multiple problems. And even you use a global balance, you have to tackle, for example, thyroid, local pains, gynecological disorder, the heart palpitations, and something like this. And it's all in one channel. And you see it's a kidney channel, thyroid, heart, gynecological. So the whole meridian is sick. And instead of putting many needles, we decide to put just 2 on each meridian. 2 in Chinese is ma. So you kind of embrace the whole meridian with 2 needles only. But the question is where to put these 2 needles. And that's why we need the meridian conversion, because the meridian conversion uses the wisdom of Bagua. It's based on Bagua only. Also, we use meridian conversion when the problem has a global meaning for the body. For example, the cold or the tiredness or can't go to sleep. It's just a general problem of the body, fever. Of course, you can resolve it with some points. Of course, it will work somehow, but this is another approach. Important. We use meridian conversion when there are many problems in one single meridian. Instead of many needles, we use only 2. So this is number 1. And the second one, when there is a global problem, depression, tiredness, well, whatever, sickness, whole body sickness. Okay, got it. Take the birds are singing somewhere. Okay, I can hear that. Where are the birds? In which country?
Netherlands.
Netherlands. Oh, I lived in Amsterdam for 2 years.
Ah, you hear the seagulls.
Oh,
I can see the ocean.
How good. All right.
And it's nice weather, so I'm outside now.
Beautiful. So, going to meridian conversion, let me find something for you. Just a sec. One little thing. Little break for 1 single minute. No, that's not this. Go somewhere. Apologies. Apologies. Let's see. Okay, let's do that. Okay, sorry, this is the Russian version, but it doesn't really matter because we all know this fusigwa. Yeah. Okay, we'll see it later. We'll see it later. Good. All right. Ready. All right. So we all know the fusigwa. In this view, yes. When the universe began, it has been divided to yang and yin. Then each yang has been divided to yang and to yin, which is more yang, less yin, more yin, another one more yang, another one more yin. And eventually we come up with 8 trigrams. We went through this conversation when we studied the system number 1. Yeah, we all remember that. So this is this diversity, these 8 trigrams, they represent all the channels. And when we distribute them in the circle, we come up to fusigwa in a very, well, let's say in a popular way, okay? Someone distributed the channels like this, just someone. Let's say that it had been done in a way. But 900 years ago, 2 physicians, Zhou Zhuyu and Jiang Shenxiu, they changed the distribution of the meridians. What I want to say, this is the same Bagua, fusigwa. This is fusigwa, and this is fusigwa. Both the same, but distribution of the meridians is different. And this is the main confusion in all webinars, seminars about the advanced method. Because so many Bagwas, now we come to ID, and what is ID? So, the left one, fusigwa, it was at the beginning. It was one distribution of the meridian. But now we forget about it. Just forget. Okay? We cross it out and we will work with the right Bagua. This is fusigwa. But let's follow the logic of the physicians who distributed the meridians in a different way. Now you can see them. Yes, clearly. But let's think how they what thinking. Okay. If we think about the middle jaw, so the bagua, let's say, reproduces the trunk, the organs, the body, the whole body. If we think about the middle jaw, what kind of meridians will introduce the middle jaw? Stomach and spleen. Solar plexus, the solar chakra, stomach and spleen. How to distinguish yin trigram from yang trigram? On the stomach, there are 4 yaos.
Yeah.
So it's yin or yang? It's yin. Number 5 in stomach goes to the yang. Okay. And this distribution, we will, of gua, of yao in gua, we call meridian ID. So if we say, if we say spleen, there is a long yao on the bottom, which represents yang. Then it's a double line in the middle, which represents yin. And then the third one is yang. So if I say pam, 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 this is spleen. Pam, 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 pam. But if I say pam, 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 pam,
Stomach.
this is stomach. And look, spleen, it's like, let's see, the yin is in the middle. Let's say it looks like a sandwich, but vegetarian sandwich. Okay? But the stomach, let's say it looks like the sandwich with chicken or meat. So very young in between. Okay? So we must remember this the idea of the meridian. To practice now, let me share the screen. Just a sec. Sharing is screen share. Just a sec. Let me draw. So spleen. Pum, 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 pum. This is spleen. And this is spleen ID. And this is vegetarian, veggie. Okay? But this is stomach ID. Of stomach. And this is meat sandwich. All right? Got it. Spleen is yin, stomach is yang. And we will practice it because we have to remember the meridian IDs, and then we'll practice the 5 elements and seasonal balance and do meridian conversion without thinking. It's so easy. Now let's think. Which are 2 meridians, yang meridians, that go from the top to the bottom? Gallbladder and bladder, correct? So here they are on the top. Gallbladder and bladder. Okay, And now, which are two meridians that go from the bottom up to the heel, to the top? Kidney and liver. And you can see them in the bottom. They are both yin. So look, kidney and liver, they share the same trigram, the same gua. The same as bladder and gallbladder. So the gallbladder ID will be 3 yang. Pam, pam, pam. The same as bladder ID. Pam, pam, pam. 3. The yin, kidney and liver. Pam, 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 pam. Got it. Now we go to the pericardium and heart. 2 yin meridians. They're on the top. The organs are on the top. They share the same gua. Look, this is the heart. Okay, this is how to remember them. 2 yang on the bottom and yin on the top, which like you can draw the heart. Okay. And the lung, again, the organ is in the top, but we turn it upside down. Don't forget that the bagua is written in a way for sigua that the man is staying in the middle. So this is the bottom. The bottom is here. Okay. So the ID for the lung will be yin on the bottom and 2 yang on the top. The ID for heart and pericardium is 2 yang on the bottom and the yin yang on the top. We have 2 left. Small intestine and Senjiao. The organs are in the low jiao as well as large intestine. Let's change the, okay. So for large intestine, I will draw it here. We have, this is this meridian ID. And for small intestine and Senjiao, we have, oops, how to draw? Okay, I will draw this here. Okay. I will tell you how to distinguish them. Look, we have large intestine and small intestine. Which organ, which intestine is lower? Large intestine or small intestine? In the belly, which is lower?
Large.
Large intestine is lower.
Yeah.
So look, where is the yang? This is the large intestine, and then it goes to the anus, okay? So the yang is on the bottom, large intestine is on the bottom, lower. Here, Senjiao and small intestine share the same gua. Look. The small intestine is higher than large intestine, so it's on the top. We say it just to remember the ID. Okay? There is nothing else. Of course, this is not an explanation of the gua. We just try to match the right image. Okay. So the exam. Okay. The exam comes. Just a sec. We'll take it out. take it out. Okay. Clear. No, it doesn't work. Sorry, eraser. I see. This works. Good. All right, the exam. Or revision or test, whatever you want, just for us. The bum, 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 bum. The sandwich, vegetarian sandwich goes for
Spleen.
spleen. Spleen. Bum, 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 bum. You remember the heart? Yeah, this is the heart and pericardium. Very good. If we turn it upside down, the organ is on the top, heart, pericardium. But we just turn it upside down. Which organ we have?
Lung.
Yeah, we have lung. Okay, let's. Okay, pum 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 pum. The meaty sandwich. Yeah, it's stomach. Yes, the youngish. Okay, chicken burger. The intestine is on the top, the young is on the top, and hin is on the bottom. Is it large intestine or small intestine?
Small.
Small intestine and Sunjiao. Yeah, they're together. And if we have it on the bottom, this is
Large intestine.
large intestine. That's it. Ah, no, we forgot them. Very yin. They're on the top, on the bottom? On the bottom. Yin is on the bottom. Yes. Kidney and liver. And now we have 3 yang, which go from the top to the bottom, is for gallbladder and bladder. Easy. This is ID. And now we come to very interesting understanding. Which is important to highlight. We all know that treating just the hand, the lower arm, sorry, not the hand, lower arm, from the fingers to the elbow, we can treat the whole body. Do we? Why? Because if we use the image, direct image, for example, it can introduce the part from the umbilicus to the bottom, or from umbilicus to the trunk, or the whole leg. If we use reverse image, it will introduce the upper part of the body. So this segment can describe the whole body, right? Agree? So we must all agree, otherwise we can't go forward. To be honest, with the same logic, one finger can introduce the whole body. I agree. But why we practice balance method? Because if we use only a finger as an image, we have to be very precise with needling. So it's difficult to find the ashi points and well, work it out. But with the arm, lower arm, it's easy. We have the kingdom to investigate, right? That's why we are excuse me, some technical things. Just looking for the drawing that I made this morning for you. Yes, I think this one. Yeah. So how can we describe the body using the wisdom of I Ching? In I Ching, we have 64 hexagrams, and we all know this. Yeah, 64 hexagrams, 6 lines in each hexagram. So the question is there any trick or something we can think about? How can we match these 6 hexagrams to the 6 lines, sorry, in hexagram to the description of the body? One, two, three, 4, 5, 6. We, for example, can level the 6 hexagrams with the level of the body. The low yao, the second yao, the third yao, the fourth, fifth, sixth, and 6, for example. Makes sense. So we kind of put it on the top. At the same time, if we agree that low arm reproduce the whole body, we can think that where the fingers are, that will be the low yao, yao number 1. And then climbing up to the elbow, that will be yao number 6. Okay? 1, 2, 3, 4, 5, 6. So we kind of put on the top the 6 yaos from I Ching, a hexagram. Understand? And we agree that there is a system that describes the geometry of the body. And we know this system, we call them antique points. And masters, and in particular Ching, he matched the antique points with the yao on each hexagram. And here you can see that, for example, the first phalange is the first yao. The second could be the second yao, the third yao, the fifth, and the sixth. For example, this is how we describe from low to the top. At the same way, we can distribute 6 yao along the whole arm. Okay? At the same time, it will describe the body. Is this clear? And now, let me explain to you Any questions so far?
Do you mean that the upper arm you can divide also in 6 jiaos?
Yes,
Okay.
yes. And because we now agreed that there is a system, there can be another system, but we chosen the antique points because the antique points, they are on the low arm, right? I think, okay, let's try and see how it will work. Let's agree that the first yao, and you can find it here, okay? First yao, okay? Just for the liver, let's speak about liver, it's just here. Let's say that Jing will, which is liver 1, will introduce the first yao, okay? The same as another Jing will, heart 9, will introduce the first yao. So all Jing wells on the feet and on the fingers will represent the first yao, okay? The second yao is Jing river points, okay? The next level, the next antique point. We're going to the top higher, okay? The second yao for yang, the same rule. So second yao is the second antique point, which is Jing river. Now we're coming to the third yao because we want to describe the human body using the wisdom on I Ching. We want to research into it. We want to understand whether the human body, the distribution of the rules and, well, whatever, can be described in the same way as I Ching. And we use this antique points as a level of matching it with the yao. The third yao is shoestring points, which are for yin organs are yuan points. We add them up. No, sorry, the fourth yao shoestring. The third yao, we add them up. Why? Because we have 5 antique points and 6 yao. So we have to add something. Let's add yuan points. So we add yuan points for yang organs. And we add lower points for yin organs. Because yuan points are already there. So I will write it down. So you will have it clear. This is a bit confusing, but we will learn it and go through. So here we add a lower point. And here for yang, we add yuan. Why we don't add yuan point for yin organs? Because it's already there. You understand? But you will see that the level, if all yuan points are in the fourth yao, for yuan organs here, all yuan points, they are here. Then yuan points, then lower points for yin organs, they move. They move between 5th and 4th yao, because the number of the points, they just mismatch. So we just put them in the order, in the right order. For example, P6 is yuan point for pericardium is in the 4th yao. Kidney 4 is on the 4th yao. Lung 7 is in the 5th yao. Spleen 4 is the 4th yao, H5, and liver 5 is here. So we can see that 5 antique points plus yuan and plus luo can represent as the segment of the arm as the whole human body. So we have a key to describe everything. So we have a key to match the wisdom of I Ching, of hexagram, and match and put it on the human body and see how the law of universe, how we can use the law of universe in terms of acupuncture. Do you understand it? So we found the key. Here we are. So each hexagram here is a human body. 2 hands and 2 legs. Each hexagram represents a condition of the universe, condition of the human body. There are a lot of translations of I Ching nowadays. And before Saturday, I advise you to go and see some descriptions of hexagrams. Possibly you already did it because it's very interesting. But it will help us enormously in a week time. Today we will not do this. We'll just have to understand the technical way of do the meridian conversion. So we agree that this is either arm up to the elbow. Yes, it's not a good, oh my God, that's really something bad. So this is the arm, 6 lines from the bottom to the top, or the human body. And this is the same as the arm as human body. And now we'll have 5-10 minutes break, tea break. And the next hour we'll do meridian conversion for each, for all 12 patterns of global balance. Okay? We passed the most difficult part of understanding. This is the theoretical basement. Any questions so far? This is good. So we all got it. Good. So we'll have a cup of coffee now. We'll be more awake in 5-10 minutes. What would you prefer, 5 or 10? I think 10.
10.
Because in 5 minutes, yes, 10. So
Thank you.
see you in 10 minutes time. Okay.
Yes.
Okay.